So let's wrap up our week of talking about disorders by thinking about some disorders that are common during childhood. So, first of all, let's start off with autism spectrum disorder, which falls under the category of neurodevelopmental disorders in the DSM 5. Autism, or autism spectrum disorders, is a developmental disorder characterized by communication, social, and behavioral challenges. The condition is lifelong, and symptoms can vary considerably from one person to the next. Autism is referred to as a spectrum disorder because there is so much variation in the terms of the types of symptoms that people experience and the severity of those symptoms. Symptoms can include deficits in language, social bonding, reading emotions, nonverbal communication, restricted and fixated interests. So, you ever have an autistic kid who only wants to talk to you about pirate ships and is not interested in anything else? Dysregulated reactivity to sensory input. A lot of autistic kids are really, really sensitive to sensory activities. So they might not like touching anything sticky or anything slimy, or they have trouble eating things like yogurt because of the sensory issues. And restricted repetitive motion, which is also known as stimming. So, sort of that rocking back and forth behavior or the gestures with their hands. And I'll show you a video of that in a minute. Signs of autism are typically first noticed by parents, but they may be spotted by other caregivers, teachers, and doctors. Early screening and evaluation are so important. We know quite a bit about how behavioral interventions can be far more effective the earlier they start. So, the sooner that a diagnosis is made, the sooner interventions can begin. Well, what's interesting is that there's no specific test that can determine if someone has autism. It's not like we can just administer a survey or something. Normally, doctors would diagnose autism by looking at behaviors and asking the parents questions about development. We see autism early. It can be reliably diagnosed in children as young as age 2. Symptoms will first begin to appear during the first few years of life. While autism is typically diagnosed in early childhood, it can be diagnosed during adolescence or adulthood. This is usually more so the case with less severe autism. Remember how I mentioned it's a spectrum? However, later diagnosis can be more challenging because sometimes the symptoms of autism can be confused with other mental health conditions like anxiety, OCD, and ADHD, which we'll talk about in a minute. According to statistics from the Center for Disease Control and Prevention, 1 in 54 8-year-old children has autism spectrum disorder. They've also reported that the condition was present in all ethnic, racial, and socioeconomic groups, but autism spectrum disorder is 4 times more common in boys than girls. We more often see autistic boys compared to girls. Prevalence statistics indicate that autism is more common now than it was in the past. It appears to be growing as much as 10 to 17% over the past few years. So, if we look at 1992, the number of cases was fairly low, up to 2008, where there were 300,000 diagnoses of autism. Whoa, okay. So, people are getting more autism now, right? Okay, that's one explanation. A better one is that we're simply diagnosing it more. Most experts would agree that the rate of autism is not increasing. The rate of autism diagnosis is increasing. So the increasing trend that we see in rates more likely reflects greater diagnosis and knowledge about what autism is. I want to take some time to talk about some myths of autism. For example, that people with autism don't want friends. That's not really true. People with autism typically struggle with social skills, which may make it difficult for them to interact with peers. They might seem shy or unfriendly, but it's not because they don't want friends or don't want social interaction. It's because they're unable to communicate their desire for relationships the same way as a typically developing person. People with autism typically struggle with emotion. They have a hard time reading the emotions of others, but this doesn't mean that they can't feel or express emotions. They just struggle to communicate them, and they perceive emotion and things like your expression in different ways. There's a myth that people with autism are stupid or intellectually disabled or mentally handicapped. That's actually not true. Oftentimes, many people with autism have normal or even higher than average IQs, and often they excel at things like math or music or other pursuits. People also think that those with autism are just like Dustin Hoffman's character in Rain Man. So autism is a spectrum disorder. Its characteristics vary from significantly from person to person. So knowing one person with autism means that you know one person with autism. Another person's capabilities and limitations are no indication of the capabilities and limitations of another person with autism. And I sort of alluded to this earlier, but people either tend to think that those with autism are intellectually handicapped or are savants, meaning that they are exceptional in a given topic. So sometimes you'll see somebody with autism who's a musical prodigy. Okay, that certainly happens, but I would say that's more the exception than the norm. Another myth is that people will grow out of their autistic qualities. Not typically. Autism stems from a biological condition that affects brain development. It is generally a lifelong condition. While there are treatments and even some medication that can help to control or to change the symptoms and the problem behaviors, people typically do not recover from autism. There is a myth that autism only affects children, but as I mentioned, that's not true. First of all, children with autism grow up to be adults with autism, but also we can diagnose adults as well. And finally, let's touch on the vaccine thing. There is a myth that autism is caused by vaccinating children. There is not a scrap of empirical evidence to suggest this. That finding came from a bogus study that sort of caught on in the media like wildfire. So let me be very clear, autism is not caused by vaccines. There is no scientific evidence of this whatsoever. So I want to show you a video of stimming. This is that repeated, restricted, repetitive motion that you see from autistic individuals. Stimming usually refers to self-stimulation. We don't exactly know why children do this. The best guess is that they get some sort of intrinsic value out of it. Maybe they like the way that it feels or like the way that it looks. But let me show you what this can look like in one child. So you see it in his face, he's making facial expressions, in the hands and the arms, how he's sort of flailing. Jiggling his legs. We see a lot of jumping behaviors, there's a lot of rocking behaviors. You also hear him, he's stimming verbally. You hear him sort of humming. And again, this will look different in all children, but that's a pretty good example of what some common stimming behaviors look like. In the past, ADHD, or attention deficit hyperactivity disorder, was considered a condition that children had and then grew out of before they reached adulthood. But now we know that ADHD is a neurological condition that spans the lifetime. The symptoms change with time, however, so childhood hyperactivity may decrease as adults find healthy ways to channel their energy. For even with the shift in symptoms, ADHD can still interfere with adult functioning. Relationships, health, work, and finances are just a few areas of a person's life that may be impacted, but ADHD often goes undiagnosed for quite some time. Many adults who have felt lazy or scatterbrained or unable to focus are actually quite surprised to learn that they meet the characteristics of ADHD. Signs of ADHD in children can include a wide range of academic, social, and behavioral problems. Adults with ADHD may become bored easily, may take a long time to complete tasks, may appear to have trouble listening during conversations. Even individuals who know they have ADHD sometimes struggle to recognize the behaviors and issues that stem from their diagnosis. They may think that being distracted or behaving impulsively is just part of who they are, rather than a symptom of their condition. There's often moral judgments made around the behaviors that result from having ADHD. For example, not being able to sit still at a meeting might be called disrespectful, or a person who makes what seems like careless mistakes might be labeled as unmotivated. Let's take a quick look at a day in the life of someone with ADHD.
I wake up suddenly, search for my phone. What time is it? Oh, okay, still early. It takes me a while to fall back to sleep, restless legs, but as soon as I do, the alarm goes off. The snooze button and I trade punches until my fiance turns it off. I jolt awake. What time is it now? I scramble for my phone. 11 a.m. Shoot! I growl at my fiance. Why did you turn off the alarm? I stumble toward the dryer for clean clothes, but you're still in the washer. I start a new cycle, then dig through the hamper, literally sniffing for something to wear. I throw on semi-decent clothes, deodorant, mascara, and take my meds. Oh, I'm almost out. Shoot, gotta make an appointment to get another prescription. I grab a breakfast bar on the way out the door. And then I grab my phone. And back again for my keys. 11:19, still good. I'll make my meeting. 12:17, I should have called. So sorry I'm late. My friend is unfazed. I can't decide if I'm grateful she isn't or depressed that she expected it. She says, I used to have trouble with that too, so now I just leave early. But this is what I hear. I can do it, why can't you? I don't know, I try it, it never seems to work out. I don't get it either. She starts pitching an internet project she wants me to write, and I'm having trouble focusing. I'm doing a good job of pretending though. I got the thoughtful nod down. Oh, I've missed half of what she's saying. Oops. I start playing with my fidget spinner to ground my attention. Focusing gets easier, but this doesn't look good as the thoughtful nod. Until she's wondering if I'm listening now. It's the irony. I awkwardly end the meeting. I check my bullet journal, the only planner I've ever been able to sort of stick to see what's next. Okay, I've got research from 2 to 5 p.m., dinner to 5 to 6 p.m., writing 6 to 9 p.m., relax 9 to 11:30 p.m., bed by midnight. Totally doable. I throw myself into the research until my alarm goes off at 5, reminding me to stop for dinner. But there's stuff I still don't understand yet. I'll just keep going until 6. Now it's 7 and I'm starving. I grab way
Okay.
too much food.
Let's move on. I want to talk about some myths of ADHD. So first off, we hear a lot about ADHD in the media. People say that ADHD is not a real disorder. This is not true. ADHD is recognized as a disorder by the majority of professional medical, psychiatric, psychological, and educational associations and organizations. One factor that contributes to the misunderstanding about ADHD's status is that no specific test exists that can definitively identify the disorder. So, unlike other medical conditions, a doctor can't confirm a diagnosis of ADHD with a laboratory or imaging test. This is similar to autism in that sense. Another factor is that ADHD symptoms are not always clearly defined and often resemble those of other conditions. There's a myth that ADHD is overdiagnosed. So the evidence here is mixed, when in fact diagnosis may simply depend on things like age and gender. There's a myth that ADHD is caused by poor parenting. So parents of children with ADHD may worry that they're somehow to blame for their child's behavior, but the condition is not caused by poor parenting. While any child, whether or not they have ADHD, can be adversely affected by a chaotic home or parenting that is punitive and critical, these factors make it more difficult for children and their families to cope with ADHD, but ultimately the parenting factors do not cause the condition. There's a myth that only children can have ADHD, so the symptoms must be present by the age of 7 to meet the criteria for diagnosis, but many individuals remain undiagnosed until adulthood. There's a myth that hyperactivity is always a symptom. So the attention deficit part of the name has led to misunderstandings about the nature of ADHD and perpetuated myths about its symptoms. But in fact, there's many different types, which don't all require hyperactivity for a diagnosis. There's a myth that people with ADHD can't focus at all. Given the condition's name, it can be confusing for people to see someone with ADHD focusing intently on an activity. So it's more accurate to describe the attention deficit part of ADHD as difficulty regulating attention rather than the inability to pay attention. And finally, there's a myth that medication can cure ADHD. It cannot. It can help manage symptoms when taken correctly, but ultimately, like autism, ADHD is a chronic lifelong condition. So that brings us to the end of our discussion about childhood disorders, but also to our week on disorders altogether. I hope you were able to resist medical student syndrome and you have not gone about diagnosing yourself and everyone you know, which I know can be a very real challenge with this content. So I will see you all next week where we will continue this conversation by talking about treatment. You might notice that I didn't mention anything about how to treat these disorders. That is the next topic. So I will see you all then.